Hello, everyone, and welcome to the first ever National American Indian and Alaska Native Prevention Technology Transfer Center webinar. Today, we're going to be covering substance abuse prevention in American Indian and Alaska Native communities, challenges and opportunities for growth, and you're going to be introduced to our staff on this project, which include Dr. Angelina Skinstad, who is the project director, Shawn Bear, who is the co-director, and Cindy Sagaway, who is the program manager. I'm sorry, I think I said the wrong thing for Shawn. Shawn is the co-director of the project. And I'm Kate Trams, and just here to get things started today, and just want to let you know that this webinar is provided by the National American Indian and Alaska Native Prevention Technology Transfer Center, which is funded by the Substance Abuse and Mental Health Services Administration. We're currently working on setting up our website. This is a new project, so the best way to reach us currently is through email, and if you want more information, please get in touch with Cindy. Her email is in the notes below, so we would love to hear from you and hope that you get in touch with us. We want to let you know that after the webinar today, you will have the opportunity to earn continuing education hours, or CEUs. So there is a form that you can download in the files pod, or we'll also be sending this out to everyone who attended, as well as the handouts for the presentation and the link to the recording as we're recording this. So you can view it again, or you can hand it off to colleagues. We're also going to be redirecting you as we close out today to the evaluation that SAMHSA has created for this project. This is the GPRA, the Government Performance and Results Act. So we would love it if you would take a few minutes and let us know what you thought of today's presentation. This just takes a couple of minutes to quick answer a few questions, and we would really, really love to hear your thoughts and comments, or just your feelings about how things were covered today. Just a couple of things about how to use Adobe Connect. We have a chat box that is just to the right of the presentation slide. So I see people are already getting involved. They're sharing where they're coming from, and that's wonderful to hear. I hope people continue to participate and share comments and questions in there throughout the webinar today, and we'll address questions when we get a chance to. And I think that all of our presenters are going to be introducing themselves a little bit, but I wanted their bios are all, I've got them all here so you can get an idea of where they're coming from. Dr. Skinstad is the director of the project, and she has been working in substance use counseling and behavioral health for many, many years, and has operated a addiction technology transfer center out of the University of Iowa since 1995 in different capacities, but now is working nationally serving Native American communities. Shawn Bear has also been working here at the National American Indian and Alaska Native Addiction Technology Transfer Center for the last 5 years, and then now has become the co-director of the project, as well as the Prevention Technology Transfer Center network. And Cindy Sagaway is new to us. She has just joined with this new project on prevention, and she comes with a background in pharmacy, and we're thrilled to have her here with this unique experience that she brings. And I am just going to pull up their slides, and I'll pass things over to them.
Hi everyone. Thank you so much, Kate. Can everyone hear me? If you can hear me, just say hi.
Yeah, that sounds good. Thanks, Cindy.
All right, thanks. So thank you everyone for joining us. This is the first of many webinars in our webinar series for the PTTC in the American Indian and Alaska Native PTTC Center. And today's webinar, we'll be looking at substance abuse prevention in American Indian communities, the challenges and opportunities for growth. So joining me on this presentation will be Dr. Anna Helena Skinstad and Shawn Bear. So we will move on to keep moving on. And the objectives of this webinar, first and foremost, is to introduce everyone to the American Indian and Alaska Native PTTC. And we're still working closely with our advisory council to get a more appropriate name. So bear with us. This is our current name for now. Maybe by the next webinar, we'll finally have our official name. And this webinar will introduce you to the team and our mission to tribal communities. We'll also look at the focus areas and services we would be providing in these communities. And then Shawn will take us into substance abuse in American Indian communities, historical trauma and substance abuse, and how substance abuse interconnects with other behavioral health issues in these communities. So Shawn will also take us through cultural connectedness and cultural humility, and he has a lot of experience here, and it will be exciting to hear what he has to say. So first and foremost, our center is funded by SAMHSA, and this webinar does not necessarily reflect the views and policies of SAMHSA. So introducing you to our network, we are the American Indian and Alaska Native PTTC. We are located in the Hawkeye State of Iowa, and we are one of 3 national PTTCs in the network, and we also have 10 regional PTTCs. So just to show you where we are located right here in Iowa. So thank you for joining us. And today we are having a really cold winter, and everyone is doing this webinar from, remotely from their home. So thank you everyone for joining us through this. So this is the National American Indian and Alaska Native PTTC team. Our director is Dr. Anna Helena Shinstad, and she has, as Kate mentioned, she has a lot of experience working in tribal communities and a lot of experience in prevention. Our co-director, Shawn Bear, who is a member of the Meskwaki Nation. He also has a lot of experience in substance abuse prevention and recovery services in Native communities. And I am the program coordinator. My name is Cindy Sego, and I'm a member of the Akan tribe from Ghana. And my background is in pharmacy, and I also have a lot of passion working in communities over time. Other members of our team, we have Kate Tramps, who is our web and communications manager. She was the one who introduced this webinar. We also have Paul Gilbert, who is a prevention specialist and also has a lot of experience working in prevention. We have Shelley Campo, who is a health campaign specialist, and our graduate research assistant, Sarah Murray, who is also a member of the team. We also have other members of the team, an independent evaluator from the University of Miami, who would also be working closely with us on evaluating the program that we're working on. Our center has a really active advisory council, who have been working with us for over 6 years. They're members from various tribal communities and or members of American Indian and Alaska Native descent from across the country. They're tribal leaders, they're tribal researchers, they're urban and tribal behavioral health program specialists. Some are tribal judges. We have spiritual leaders and even ex official members from IHS. So we have a really robust team. And I'd like to add that these are well established and trusted relationships, which are going to make possible, and strengthen the work that we do with substance abuse prevention workforce in tribal communities. So our mission, we're really passionate about tribal communities, and what we want to do is work with organizations and prevention specialists who are involved in the delivery of primary prevention services in tribal communities. So we're talking about people who are working with tribal individuals, families, tribal and urban Indian communities. What we want to do is strengthen their capacity to deliver effective evidence-based practice to these individuals and communities. And how we are going to do this is, first and foremost, we're going to leverage on the prevention expertise and tribal resources that we have. We have, like I mentioned, we have a really strong advisory council who I said are tribal leaders, spiritual leaders, members of tribal communities. We also have a really strong, robust team who have had experience working with tribal communities, some for over 20 years. Dr. Shinstad has experience working in prevention for over 20 years. Shawn Bear has really strong experience working in substance abuse prevention and recovery for several years. So this is a really robust team, and our aim is to, provide training and technical assistance services, which is the second method we're going to use. That will be enhancing the prevention TA infrastructure in tribal communities so as to increase the substance abuse prevention capacity, the skills and expertise for specialists working in tribal communities. Thirdly, we're looking at improving the quality of culturally informed and knowledge-based substance use prevention efforts in these communities, and we're looking at seeing it gain and accelerate to a nationwide adoption. So going forward, our main focus areas will be substance abuse prevention. But then we also know that when we're working in the prevention field, there are also other aspects that also that also have a root cause analysis or also affect substance abuse in whatever field you are working in. So we're also going to be working in suicide prevention, gender-based violence prevention. We're also going to have a Native American Leadership Academy. We have a team that is also working specifically on that, and we'll be working closely with them. We'll also, part of our services will be an expansion of telebehavioral services to urban and Indian tribal communities. We're going to provide network-wide TA to promote the adoption and diffusion of culturally informed evidence-based practices to the prevention field. So this will be our key focus areas, and we have so much that we're going to be working on, and we'll discuss some of that later on. So I'm going to hand over to Shawn to tell us more about, why we're passionate about Native communities and why we're working there.
Hello, this is Shawn Bear speaking. I'm from the Meskwaki tribe in Tame, Iowa. Yeah. So why Native communities? Speaking broadly, American Indians, Alaska Natives are a diverse population with 574 federally recognized tribes and many more state recognized or community recognized, and many more are still awaiting federal recognition. There are more than 5 million individuals identified as either American Indian, Alaska Native alone or in combination with one or more other races. About 3 million of those identify as exclusively American Indian or Alaska Native. In addition to recognizing diversity among American Indian and Alaska Native populations, it is important to appreciate their distinctive demographic context compared with other Americans. The Native Americans live predominantly in the West or South, while the majority live in urban, suburban, or small rural towns that remain more likely than other Americans to live in rural areas or small rural towns that are close to the reservations. On average, they are younger and poorer than the general population. The urban and suburban Native populations is remarkably diffuse, largely because of past federal relocation policies in the mid-20th century, with purposefully dispersed natives and relocated them into urban areas to encourage integration, with expectation that they not return to the tribe. American Indian, Alaska Native urban enclaves are rare. Where they do exist, represent various tribal and cultural backgrounds, beliefs, and practices. Statistical sampling is extremely difficult and normally portray natives in a negative light. As a result, most epidemiological research with natives are conducted within reservations and rural tribal community settings which focus on the minority. while overall nation's population of natives include those of more than one race is just over 2% of the population. I think it's more like a 2.019 or something like that. So geography and location does matter. Certain geographic locations are higher percentage of natives, such as in the West and South, which has the largest native population in the United States. In native community statistical areas, they are roughly 22% of the population. In addition, between 2000 and 2010, the U.S. Census Bureau reported that in American Indian and Alaska Native populations grew at twice the rate of any other race and in every region of the United States. So here you'll see a map which includes the IHS areas. From the ATTCs, including the national ATTCs, they don't necessarily overlap with each other very well. You'll see that with the tribal IHS areas, they're kind of similar to the tribal areas of the regions in a sense, but not always. But with ATTC regions, they may have either like sometimes 2 or 3 different ATTC centers that can assist the American Indian and Alaska Native populations.
Are you going to address this, Shawn? This slide?
This here is where Ana Helena begins hers.
Okay. Okay. Thank you very much. One thing that I always feel is an issue when we start doing webinars like this is that we focus a lot on the challenges and the issues that the Native communities are faced with. And all of these issues are very complex, but that's not the whole story. So I want you to know that we often and mostly would take a strength approach to our work with tribal communities, but in doing that, we need to know what is happening, what are the evidence of prevalence, what is the burden of disease, if you may. And with prevention, we really want to start early, so we would like to know a little bit about initiation, and we have a fairly high rate of early initiation of use of alcohol and illicit drugs in Native communities. And as you can also see, that there is a high rate of smoking early, starting at 12 and 17, 16.8% compared to 10.2%. And it's a similar kind of disparity when it comes to marijuana and non-medical use of prescription drugs. And the latter is, of course, something that we are very, very concerned about. And also, we know something about binge drinking, that is the very high evidence prevalence of binge drinking in our Native communities, both urban and Indian, urban and tribal. So with that, it's very important to think about what does it take for us to turn this tide. what do we want to do to make sure that with the data we have, that we try to focus on the early internet initiation and trying to see if we can change that and be prepared with early interventions for young people who are coming in to our clinics or our schools. And what we are specifically trying to do also with one of our projects is to look at how is it possible to think about prevention specifically in young teens when it comes to use of opiate addiction, because it is becoming more and more serious in tribal and urban Indian communities. And one of the things we've seen is that in all these stats, unfortunately, the Native community has a higher burden of disease than other ethnic groups. There are very many factors that we have to take into consideration and that we really want to address a little further. And that is that some risk factors can also be protective factors in other situations. So early initiation of drug and alcohol use is usually pointing in the direction of chronic use. And we want to make sure that we change the age of initiation. We have also found that cultural identity can be a protective factor. Culture and community norms oftentimes lead young people into thinking, how can I connect more with my community? As Shawn indicated, there are a lot of people living and working in urban Indian communities, but we have seen the need for connecting with tribal communities where they come from, where their parents may come from. So we see what often is referred to as a commuting between urban areas and rural areas to be more connected, get more cultural input, and that usually is a protective factors. Family dynamics and how families are treating each other, how families are, or parents are models for their kids, can be both positive and negative. It also depends on how this is perceived by the kids, how much support there is at home. Mental health issues, unfortunately, predispose quite a lot to substance abuse and other chronic disorders. So that is one thing that we also want to focus on. And Cindy indicated in the beginning that suicide prevention is part of what we want to include in our initiatives. Oftentimes, suicides are committed under the influence of either alcohol or drugs. We know that violence in communities may have a very negative impact on child's development, may make it very hard for kids to feel that they are able to control their environment. And when I'm saying that, what I want to highlight is that we know from extensive WHO research that if we can increase kids' ability to feel that they can control their environment, the more likely they are to be able to develop into community members that are able to enjoy that community and also be productive community members. And of course, we can never, ever forget historical trauma and recent trauma and how that can influence substance abuse. And I'm going to leave this to Shawn to talk about historical trauma.
Okay, so when it comes to historical trauma, it is necessary to first examine the question and cause of the effects, addressing healing. Much of the cause is rooted in historical trauma experienced by indigenous people. The effects are numerous. We also need to look at how historical trauma in the past has come about. Many people, when they talk about historical trauma, they also speak about the Nazi Holocaust, and speaking about how many more people had died during what is being called the American Holocaust. So historical trauma, is considered a risk factor for substance abuse and other social problems, but we also need to look at it from a compounded manner, not just looking at the historical trauma itself, but looking at trauma within the person's lifetime. Normally, everyone has some type of trauma from their childhood and growing up. Of course, there's more. Of course, there's going to be more when it comes to like combat-related PTSD and things like that. Also can come from suicide and things that are going on with the family when it comes to substance abuse. Normally what happens within substance abuse is there's also more abuse, such as physical abuse, sexual abuse, many things like that. But from a Native standpoint, all abuse was considered wrong. So then, like with sexual abuse, physical abuse, those things were normally handled within the tribe, actually very extreme in many cases. Those are coming from different belief systems and practices from many different tribes around the United States. But these kind of form also within and affects the DNA, so they're able to pass that on to the next generation. It's very difficult, I think, and historical trauma is looked at as something that's come about, and I think there's more studies now that just came about, and scientists have realized that trauma can be passed down, I believe, 14 generations. Okay, so when it comes to indigenous peoples, suffer disproportionately across many health factors, including an increased risk of substance abuse. Today, many American Indians, Alaska Natives, youth experience trauma at higher rates than any other in the United States. Native youth are 2.5 times more likely to experience trauma compared to their non-Native peers. This may also come from discrimination, racism while in schools. Many times even from the schools that are on the tribal lands. Today there are many natives who are not always full-blood, but they can also get discriminated against by natives themselves. What kind of makes it kind of difficult as well is looking at even kind of more modern time is that we have native students who go to school. They're really pushed to go to college to get further education to be able to come back and help their tribal members. But normally what happens then is when they come back from college and during that time that they're away, what happens is that many of the tribal members are not seeing them. They're seeing them change in a way with their education, with their knowledge bases, and the things that they know. So they tend to be, in a sense, experience some kind of either trauma or discrimination from the tribal members themselves. So when they do come home, there's not always a place for them to even get a job. They have to go sometimes outside or to different tribal areas to get jobs again. So also looking at suicide, it's disproportionately affects American Indian Alaska Natives. The suicide rate among American Indians Alaska Native adolescents and adults ranges from 15 to 34 is 1.5 times higher than the national average for that age group, and is the second cause of death for that age. Annalena, do you want to continue this?
No, I think you can do that.
Okay, so substance use has a major impact on individuals, families, and communities. Higher substance use in American Indian communities contributes to a range of social problems, including violence, delinquency, mortality from suicide, and other substance abuse. So you see that as substances begin to rise within the tribes, so does crime. In a sense that when they get into substances such as methamphetamines and things like that, the crime, it kind of goes up as well, because then there's theft, more violence and stuff like that. The use of cocaine or ecstasy has been linked to abnormal cardiovascular function, ranging from abnormal heart rate to heart attacks. Approximately 1/4 of AIDS cases in the United States have resulted from injection and drug use. That is something very important when you're looking at substance abuse. Normally, if you look at substance abuse, many of these drugs will actually interfere with your decision-making process. So that can lead to risky sexual behaviors and contraction of STDs. More than half of the population arrested in the United States, including for homicide, assault, and theft, test positive for illicit drugs. In 2009, an estimated 10.5 million people under age 12 or older reported driving under the influence of illicit drugs in a previous year. In 2009, among fatally injured drivers, 18% tested positive for at least one drug. And I do know that if it hasn't changed, substance abuse is part of the leading cause of death with natives. HIV is a public health issue among American Indians, Alaska Natives, who represent about 1.3% of the U.S. Well, it's a little bit different now. It's 2%. Wait a minute. Native Americans represent about 2% of the population, but HIV is a public health issue that's affecting them as well. Overall diagnosis, HIV infections among American Indians and Alaska Natives are proportionate to their population size. Compared to other racial ethnic groups, American Indians rank 4th in the rates of HIV diagnosed in 2016. The lower rates than blacks, African Americans, Hispanic, Latinos, and people reporting multiple races, but higher rate than that of Native Hawaiians or Pacific Islanders, Asians, and whites.
Thank you very much, Shawn. I want to address some of the way we think about working on prevention issues. And one of the things I think is very important is to take a lifespan perspective and also think about the individual as part of a family, as part of friends, and have relationships. They are part of a community, and the community is part of the larger society. And one of the things that we have done so far is really, unfortunately, what we often have to do when we start preparing prevention initiatives, and that is to focus on the deficits. But what we need to think about is a much more holistic approach to understanding how we can work with Native communities. And one of the things that we think is very important is to enhance the knowledge of the substance abuse prevention workforce. And that's a challenge and a great opportunity to work with very many tribal providers to understand social attitudes and political and legal responses to consumption of alcohol and illicit drugs, and how that sort of gets into a very complex public health issue, and a public health issue that most likely is going to be very different from community to community. And we have to also look into the criminal justice system. We have been approaching healing to wellness courts, and to try to make sure that we support them in being able to think in prevention as well as in treatment and correction, because when we have a parent in a healing to wellness court, they most likely have a child, and what are we going to do to support that child? And we know something about the health disparities, and we have talked a lot about how the health disparity of the Native community is disproportionate compared to other communities. And we also need to look at this from the perspective of how this community is affected at a community level through violence. And especially, I know that even though in tribal communities we talk about opiate addiction as an early and unfortunately serious issue in the Native community, methamphetamine is still active. And often with methamphetamine abuse, there is associated violence, delinquency, and a unpredictable community. And that goes also for use of stimulants and ecstasy. One thing is the individual response. The other one is how is it in the community when a community is really affected by the use and abuse of stimulants. And also this issue of finding ways to develop culturally appropriate prevention models. And a lot of times we have quite a number of prevention models across American Indian communities that aren't very well known, but we knowing, and I'm sure people on the line who work in Native communities and know that these methods are very important and show very, very good results. And we are very interested in working on enhancing the knowledge of what are culturally appropriate prevention methods, what are prevention methods based on culturally informed practices and experience-based practices and knowledge-based practices. And we, as we've talked about before, we really want to focus on early initiation and, of course, from my perspective, talking about how to support Native women who are pregnant and who may be using while they are in preparing to give birth to a new member of the community. And we want to look at strengths and the issue of culture and community and culture as prevention, and thinking about how we can support communities in taking pride in culture and also include children in cultural initiation, in cultural ceremonies. It's very important for us to think about a culture and community as an opportunity to enhance resilience, and to also think about, by giving kids the opportunity to understand and engage and learn from elders, will give them opportunities of feeling control of their life, learning from the elders, and healing from the tragedy, because it's important to know where we came from, but it's also very important to think about how can we heal and how can we look forward even though we've had a tragedy in our past or in our present. We all know that if we try to have a holistic worldview and think about all the aspects of what it takes to heal, what it takes to be healthy, I think the medicine wheel gives us a lot of very good aspects that we need to make sure are taken care of so that the community is healthy, the individual is healthy, and the community and the individual are connected at the spiritual level. We also really want to focus on enhancement of skills among prevention specialists, and how, and I've talked a little bit about the importance of modeling. We know that tribal leaders, tribal members of tribal councils, spiritual leaders' behavior really sets the stage of the most strongest form of learning, which is modeling. If we have a positive model, we have something to strive towards. And I think that is often what we need to think about also when we want to change community norms and influence use of substances in youth. And also reframe engagement in recovery community. Reframe it from being a negative thing to being something to be proud of, and engaging youth in that pride of having been able to overcome a very difficult challenge, which is substance abuse. And I also want to highlight tribal state collaboratives. And the reason why I want to highlight that is that we all know some tribal communities have very many resources. Others do not. So that if we have someone in a mental health crisis or a substance abuse crisis, it would be important to have good collaborations with our states. And I want to highlight one group that I have been involved in when I was working in Wisconsin, and that is the Tribal and State Collaborative for Positive Change, and the communication and the efforts to use each other's resources to support each other has shown to be very effective, and I highly recommend that as a way of moving forward. So with that, I'm giving the baton over to Shawn.
Okay. Okay, so here you have a model of cultural connectedness and humility for non-native prevention specialists. Now, if you're looking at cultural connectedness to just natives themselves within the community, it's going to be different. Cultural connectedness to a native community has to do with how connected each individual feels to their community. Of course, humility is very strong within the native communities, looking at elders and medicine peoples and things like that. You have to have humility when you're working with them. But also, many of the elders, medicine people are very have a lot of humility themselves. So you're looking at cultural connectedness within here is cultural humility and health literacy. Help to share understanding of values, beliefs, needs, and priorities. On the other hand, you have the cultural humility. From here it says it's a perspective of that involves lifelong commitment to self-evaluation and self-critique, to addressing power imbalances and developing mutually beneficial and respectful partnerships. Now, within Native communities, you also want to look at just the community itself. Many times, to be able to look at cultural humility, it begins with cultural sensitivity, which is kind of a basic model for learning about different cultures. Within that, then, to become culturally competent, which is a little bit higher level. Learning more about what that community does. When you're looking at Native communities, it may be looking at the medicine wheel and how many different things within your work you're going to be doing. But with cultural humility, it actually delves further into looking at yourself and also getting into the community more and learning more about them. So if you're working with the community, it's very important to be able to be seen, to be able to get known within the community. Those who work within the tribes or with tribes who are seen in the community at community events, community things going on around that are going to be looked at a lot more in a better way than it would be with somebody who just goes to work there and then goes home. So many of the community members may see them as, well, they're just here for the money. Those who are there in many community events, getting involved with the community, they're the ones who's going to be looked at as they really care. They really care about what they're doing. They're learning a lot about the community. Sometimes they begin to utilize different words and things like that of the community itself, the different concepts that are important working with that community. So it's important to understand the values, beliefs, the needs, and priorities when working with these communities. It's, again, lifelong learning. It's going to take a very long time to be able to learn this. It's not something you can get out of a book normally. It involves getting into the community, exercising self-reflection and critique, remembering that we don't always know everything, and that sometimes what we did learn from books was not true. It involves developing a respectful partnership with diverse individuals and communities and creating relationships that benefit all involved and empower those who are working with it. It doesn't require somebody to be competent in another's culture. It involves being comfortable with not knowing. So it's here, get a little more into a bit about GONA. It's a gathering of Native Americans. They do have sites where you can get GONA training for the community. It's a culture-based planning process where community members gather to address community-identified issues. It uses an interactive approach that empowers and supports American Indian and Alaska Native tribes. The GONA approach reflects American Indian and Alaska Native cultural values, traditions, and spiritual practices. So when identifying the issues, they're able to talk through there and look at traditions and values, practices that might be able to help with that. Community-based American Indian and Alaska Native trainers, they do utilize American Indians and Alaska Natives to facilitate the GONA training with its guiding principles. Skilled facilitators can safely and effectively lead a group each day of the GONA by working to understand the community's issues and concerns in terms of the strength. That's why it's so important to be able to be Native while somebody is doing the GONA training, because even though many of the tribes are different, some things are going to be the same. Some things are going to be very similar when it comes to, even though when you're looking at the belief systems and practices, traditions may look different, may seem a little bit differently. When it comes to the spiritual aspects of what is happening within the ceremonies and things like that, it's very much the same. Okay, and I believe it is Cindy.
I can do this if, because we are struggling a little bit. We're doing this training from our individual homes in Iowa, and we have had some technical issues. I know some of you have not maybe heard Shawn as well, but I can do a little bit of the summaries. We are very committed to working with the workforce and with the organizations that offer prevention services across Native communities, and also with the awareness that there are different prevention specialist certification depending on what kind of state that the tribe or the urban Indian community is located in. We're also very interested in working with individuals, families, and the tribal and urban Indian communities, and also the federally recognized tribes. We're working with IHS. We are working with people who are experts in GONA facilitation, for instance. And we are often considered a convener because of our connection and because of our commitment to using the resources that are in our community, the urban Indian communities and outside of the urban Indian communities, and also facilitate how can tribal communities access these resources. One of the things that is very important for us is that we are not all of us Native, and we practice cultural humility on a daily basis. I think I would like to think of us as culturally sensitive, but I also instill in all my students that we will never be culturally competent. So showing humility and respect and know how to communicate and put the Western way of communicating at the door is a very important part of how we want to approach Native communities, and especially working with non-Native prevention specialists who are working in tribal communities. So in other words, we're reaching out to all of you and wanting to collaborate with you and to hear from you what is it that we should be doing. By saying that, you have the opportunity to give us feedback in our GIPRA forms, but we are also going to conduct a needs assessment to get a even better understanding of what the needs are for the prevention specialists in our tribal communities. So with that, I hand this over to Shawn or Cindy or Kate.
All right, thank you very much. I know we just have a few minutes and we would like to answer any questions anyone might have and any comments that you might have.
And feel free to submit your questions into that chat box just to the right of the presentation. And yeah, we'd love to hear any thoughts that you have. While we're waiting for any questions or comments to come in, I'll just remind everyone that we are recording today's session. So we'll be sending you a link to the recording that you can feel free to share with colleagues or view again. It'll also include handouts of the presentation and a CEU request form. So you can submit that if you would like to earn CEUs for attending. And also, just want to remind you that you should be redirected. When we close out today, you should your browser should open to our survey that we would appreciate you taking a few minutes to fill out. If it doesn't open, don't be alarmed. We will also include a link in the email that we'll send to everyone. And we just had a note up on the screen about the next webinar in this series. So we will have one next month, and this will be a recurring webinar series. So if you want to have more information, it would be great if you could email me or Cindy, and we can add you to our mailing list and make sure that you get the announcements for all of our webinars and any trainings and that kind of thing on this project. And I'll put my email here in the chat.
All right, so Deborah was asking, do you know if there are any specific initiatives addressing these points that are planned for implementation to address urban Native American populations? Shawn and Helena?
It's a very, very good question, and we are in the middle of trying to really find specific initiatives, but I'd like to give you one suggestion and one that I have heard about, and that is the drum group that is used and initiated by one of our advisory council members in Los Angeles, Dan Dickerson, and he has created a drum group initiative that has been successful. We do know that the canoe ride is a very successful prevention initiative as well, but not necessarily for urban Indian kids, but for Native kids in general. And then, of course, we have robes courses that really enhances Native kids' feeling of self-esteem and accomplishments. So those are three that come immediately to mind, but I also want to make sure that we have an overview of all of them, and that's what I know Cindy is working on at the moment. And I see that Maria is suggesting that we look into current needs assessment, and of course we would want to do that as well. This is not an easy, what should I say, way of assessing needs when we look at prevention initiatives. And if you have suggestions as to what you think would be very important for us to make sure we are aware of, please send us an email. Thank you very much for that question. I think it's very good. We don't want to reinvent the wheel.
Yes, I think that we are currently doing needs assessments around the country now and utilizing in native communities and not just on tribal but within urban areas, and seeing what they need, they see the needs as, but also utilizing professionals who work with them because they're the ones who's going to see a lot of that.
I see that several people are still typing, and thank you very much, Maria, for reference to the state of Montana Public Health. And that's a very good point because we are working with the state of Montana on this. So thank you very much for reminding me. We always like to work with people who are already doing the work and collaborating. So I know Montana would be a state we have been recently in, absolutely last, I think it was October, if I'm not mistaken, Shawn?
Yeah, I believe so. One very important thing is that within the needs assessments, it's going to vary depending upon what regions they are in. When it comes to many of the different areas, it's like canoeing. It's very prevalent within the Northwest. It's not as prevalent in other areas because part of their practice there was when they were hunting fish and stuff like that, whales and such, up that coastline. But with the canoe, they're very big canoes, more like a boat, but the canoes, I know that they do have some within some areas of the United States where they utilize canoes in large lakes and stuff like that for like the woodland tribes.
I also want to say that when Cindy was showing you the map of all the prevention technology transfer centers, they are aligned with the 10 HHS regions, which means that you, somewhere, wherever you are, there is a local ATTC that may provide resources for you too. However, they may not necessarily have to focus on native issues. So that's where we come in and try to be supportive, and oftentimes the local ATTC reaches out to us. So this is the way, here is the map, and you can see that every region, wherever your tribal communities or urban Indian communities are, there should be a local ATTC that can be helpful too. And I see that Kenneth has really written some very important suggestions for us that we will take very seriously, and I totally agree with the coping and support and the strength-based and the increase of control in people's life. That would be very, very important to engage with. So thank you very much, Kenneth.
Yeah, and with that, there's also the Red Road,
Yeah. Yes.
which the White
Absolutely.
Bison actually came from.
Yep. Mm-hmm. And what is very important is that we have to decipher what is treatment and what is prevention. However, in Native communities, that usually isn't necessarily split up in different ways of handling substance abuse or mental health or behavioral health issues. So it's very important to sort of know that the holistic approach is what is going to be most effective in Native communities. And I totally agree. We need to collaborate and we need to reach out to each other both within and outside of tribal communities to access the resources that the tribal communities have a right to. And I'm saying this after we have had a devastating government shutdown that I hope that all of you are recovering from and able to pick up the pieces after the community is supported by the federal government again.
Good. Well, thank you to everyone, and I think that probably concludes our presentation today. Unless Annalena or Shawn or Cindy, do you have anything final you want to say before we finish up?
I just want to say that I look forward to working with you, and I really appreciate all your inputs and suggestions, and we are very open to input and suggestion from you even when we end this webinar. So anything you would like to engage with us in, we would be very open to collaborating.
Yes, thank you so much, and thank you for joining us. And like I said, please get in touch if you want to be included on our announcements for webinars or other trainings and events that are going to be coming available. You can get in touch with any of the staff. The emails that are on the page, mine was up in the chat. So please get in touch, and we look forward to working with you. And with that, we'll end for today. So thank you again. And we hope you have a great day.